When do autoimmune joint diseases typically occur? A recent surge in discussions around autoimmune joint diseases has many wondering when these conditions typically arise. If you or someone you know is experiencing joint pain, you might be curious about the age and circumstances under which these diseases develop. Let's break down the facts to provide clarity on this important health topic. Autoimmune joint diseases can emerge at different stages of life, depending on the specific condition. For instance, juvenile idiopathic arthritis, which affects children, usually appears before the age of 16. This condition often manifests in late childhood or early adolescence. Symptoms of juvenile idiopathic arthritis can sometimes follow common infections, which may trigger the immune system in children who are genetically predisposed. However, it is important to note that infections do not directly cause the disease. On the other hand, rheumatoid arthritis, a common autoimmune joint disease, typically begins in adulthood. Research shows that the average age at which individuals start treatment for rheumatoid arthritis is around 48 years. This condition is more prevalent among adults, particularly affecting women during middle age. Another autoimmune condition, systemic lupus erythematosus, can also impact the joints. This disease predominantly occurs in women of childbearing age. Studies suggest that female sex hormones may play a role in the onset of this condition. Various factors, including genetic predisposition and environmental triggers like infections and exposure to ultraviolet light, can influence the timing and development of autoimmune diseases such as lupus. To summarize, juvenile idiopathic arthritis typically appears before the age of 16, often during late childhood or early adolescence. Rheumatoid arthritis usually starts in adults, often around middle age, with an average onset age of 48 years. Joint symptoms related to lupus are most common in women of childbearing age, influenced by hormones and environmental factors. Understanding when these autoimmune joint diseases typically occur can help in recognizing symptoms and seeking timely medical advice. If you have concerns about joint pain or related symptoms, consulting a healthcare professional is always a wise step.